We are at war. We have been in this fight for a year and a half with the invisible enemy known as COVID-19. It is once again on the move and punishing those who did not respect its destructive power. For the first time, I was able to go to the front lines of the battlefield, looking at the sickest patients fighting for their next breath. I've covered mass shootings, homicides, and harrowing car crashes, but I was not prepared for the harrowing images inside the Bakersfield Memorial Hospital. Nurses exhausting themselves to save the desperately ill. And sometimes their hard work isn't enough. I want to ask you about the vaccine. You said you wish you would have taken it.
I guess I didn't take it as seriously as I should have.
This virus is not the same that it was a year ago.
Our patients are sicker. This is an ugly, ugly enemy that we can't see.
It's taken a toll on us all emotionally.
Vaccination is the most effective, safest defense that we have.
What we're seeing now is a pandemic of the unvaccinated.
Down this hallway are 30 beds. All but 2 are filled with very sick patients with COVID-19. Each of them in their room hooked up to oxygen, struggling to breathe.
No one is safe from this virus.
There's a few practices I probably should have kept, but I didn't.
For those who recover, there's still damage.
Yeah, we're calling it long haulers disease. The people in ICU or the hospital that make it, their lungs are in really bad shape, and so there's going to be some scar tissue that's going to impact them probably for the rest of their life.
Here in the ICU, there are 8 beds. 7 of them are filled with COVID-positive patients, all of them sedated and clinging on to life. The youngest is just 40 years old.
We can't stop these senseless deaths.
We've had 20-year-olds die at our facility. They're healthy, they look good, and they just cannot get oxygen in their lungs.
I don't even know how many deaths that I've seen. I can't even count on 2 hands.
We had a 30-year-old last week that had his first baby newborn. Right before he was intubated, he got to see his baby on FaceTime with his wife. Never met his baby in person. That night, he passed away. So this is how serious this is.
I can't communicate via an iPad the emotion of how sorry I am that there's nothing we can do to save your mom's life, your brother's life. No one should have to go through that. And because of this virus, families, they're dying like this, left and right. I just want people to know that when their family members are here and they can't come see them, that we do uphold their dignity. They're not a number. They have a first and last name.
The amount of death has always been too much for frontline workers.
We are tired. The staff are very tired, and the doctors are very tired. But we have to press on.
But this third wave is proving to be more difficult for nurses, as it takes a toll on their well-being, trying to help patients stay alive when this pandemic could have been behind us.
It is an emotional roller coaster.
I know myself, I'm probably not taking the best care of myself.
It just is really frustrating for me to hear people just say COVID is kind of a made-up, we're making a big deal of it. It's really not that big of a deal.
It's beyond comprehension that somebody could think this is not something to worry about.
We are really frustrated because it's something that can be preventable, that can be taken care of. If everybody would have jumped on and get vaccinated, we will have maybe like 2 or 3 patients with COVID on this floor.
Hooked up to these machines and sedated in this bed. This is where a lot of patients sick with coronavirus took their last breath.
You think of your immune system as an army, right? You have a whole army and they can go fight a war, but if they haven't been constantly trained, they are not your best soldiers. So same thing with your immune system. Once you have a vaccine, your immune system is ready. It's like an army that is ready to go to war. So the moment your body gets exposed to the virus, your body's ready to fight.
I'm one of those who I was anti-vax, and now this has turned everything around.
Vaccines are free and considered the best way to prevent severe illness and death from COVID-19, according to health officials. If you are 12 or older and would like to get the vaccine, you can sign up at myturn.ca.gov. Our nurses, that was just, I spent a total of 5 hours in the hospital at Memorial Hospital. Keep in mind, these nurses have been doing this every single day for more than a year. And just talking to them, you could see how exhausted they were. and their message was across the board. They want people to get vaccinated because they don't want to deal with the suffering anymore. And they said that's what's so different about this surge compared to the other. The other surge, they tried everything they could to, to save lives, but there were no tools available. And so they were really trying to fight. They say this surge right here is mostly preventable. And so every single person that's coming in and they're losing that life, they're looking at that death and saying, this could have been prevented. The other thing that they said, a lot of the nurses say it's very difficult to talk to patients who are in the hospital, who are against the vaccine, now in the hospital, fighting for their lives, and asking, can I take the vaccine now? Well, once you have the virus, it's too late. And so that's the other thing that they're dealing with. So, to all the nurses out there at all the hospitals, thank you for everything that you're doing, especially during this this third surge. You've done so much since the beginning of this pandemic, and I know it's going to continue. But your hard work is definitely appreciated.
And those are some of those folks on the front lines that we were talking about in that suicide prevention story last half hour, because when they are constantly on in this high stress job, in this high stress environment, and they don't get that chance to ever just compose themselves and to unload and download everything that they've been through, that can add up and can lead to a breakdown. So it is something to remember to take care of yourself as well, and take care of each other, to talk about the things that you're seeing and going through and feeling.
Absolutely, it is just so important.